Nurse Aide Test Prep Drug. Question 1. A client is bleeding profusely from a wound. The nurse aide should: Option A, apply direct pressure to the wound. Option B, apply a tourniquet. Option C, elevate the wound. Option D, apply ice. The correct answer is option A. Apply direct pressure to the wound. Direct pressure with a sterile dressing is the first step to control severe bleeding. Tourniquets are for life-threatening bleeding not controlled by direct pressure. Elevation and ice are not as effective. Question 2. When assisting a client to walk, the nurse aide should walk. Option A, behind the client. Option B, next to and slightly behind the client, holding the gait belt. Option C, in front of the client. Option D, far to the side of the client. The correct answer is option B, next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 3. What is the most important action a nurse aide can take to prevent the spread of infection? Option A, wearing gloves at all times. Option B, performing hand hygiene. Option C, wearing a mask. Option D, isolating all clients. The correct answer is option B, performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 4. When using a manual blood pressure cuff, the nurse aide should inflate the cuff. Option A, to 100 mmHg. Option B, to 150 mmHg. Option C, to 180 mmHg. Option D, 30 mmHg above the estimated systolic pressure. The correct answer is option D, 30 mmHg above the estimated systolic pressure. The cuff should be inflated approximately 30 mmHg above the estimated systolic pressure, determined by palpating the radial pulse while inflating. This ensures adequate occlusion. Fixed numbers don't account for individual variations and could be insufficient or excessive. Question 5. A client with dementia is pacing and appears anxious. The nurse aide should: Option A, restrain the client to prevent falls. Option B, encourage the client to sit down and rest. Option C, walk with the client in a safe area. Option D, leave the client alone. The correct answer is option C, walk with the client in a safe area. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Pacing is a common behavior in dementia. Restraining increases agitation. Forcing the client to sit may escalate behavior. Question 6. The nurse aide is caring for a client who speaks a different language. The best approach is to: Option A, use hand gestures and hope the client understands. Option B, speak loudly and slowly. Option C, use a trained medical interpreter. Option D, ask another client to translate. The correct answer is option C, use a trained medical interpreter. A trained medical interpreter is essential for accurate communication. Hand gestures are insufficient. Speaking loudly doesn't help. Using another client violates confidentiality and may result in errors. Question 7. When assisting a client with a bath, the nurse aide should: Option A, bathe the client from cleanest to dirtiest areas. Option B, bathe from the feet up. Option C, wash the perineal area first. Option D, use one washcloth for the entire body. The correct answer is option A, bathe the client from cleanest to dirtiest areas. Bathing from cleanest to dirtiest, face first, then upper body, abdomen, arms, legs, and perineal area last, prevents spreading microorganisms. Using one washcloth for the entire body is unsanitary. Question 8. In the event of a fire, the nurse aide's priority is to: Option A, extinguish the fire. Option B, rescue clients from the immediate danger area. Option C, call the fire department. Option D, save the client's belongings. The correct answer is option B. Rescue clients from the immediate danger area. The priority is to rescue clients in immediate danger. Race, rescue, alarm, contain, extinguish. Extinguishing the fire, calling the fire department, and saving belongings are secondary to client safety. Question 9. A client with Alzheimer's disease becomes agitated when the nurse aide enters the room. The aide should: option A, leave and return later. Option B, approach slowly and speak in a calm, soothing voice. Option C, ask the client what is wrong. Option D, call for assistance. The correct answer is option B. Approach slowly and speak in a calm, soothing voice. A calm, slow approach reduces agitation. Leaving may reinforce the behavior. Asking what is wrong may be too abstract. Calling for assistance may be needed if the client is a danger to self or others. Question 10. The RACE acronym stands for: option A, rescue, alarm, contain, extinguish. Option B, run, alert, call, evacuate. Option C, rescue, assess, control, evacuate. Option D, remove, alert, contain, extinguish. The correct answer is option A. Rescue, alarm, contain, extinguish. RACE is the standard fire response protocol. Rescue clients in immediate danger, alarm, pull the fire alarm/notify, contain the fire, close doors, and extinguish, if safe. Question 11. A client's temperature is 101.2 degrees Fahrenheit. The nurse aide should: option A, document the temperature. Option B, report it to the nurse immediately. Option C, give the client a cold bath. Option D, retake it in 1 hour. The correct answer is option B. Report it to the nurse immediately. A temperature of 101.2 degrees Fahrenheit is a fever requiring immediate reporting to the nurse as it may indicate infection or other medical conditions. While documentation is important, reporting is the priority. CNAs cannot initiate cold baths without nursing orders. Retaking in 1 hour delays necessary intervention. Question 12. What does the abbreviation ADL mean? Option A, ad lib. Option B, as doctor likes. Option C, activities of daily living. Option D, after daylight. The correct answer is option C, activities of daily living. ADL stands for activities of daily living, which include bathing, dressing, toileting, eating, and mobility. This is a fundamental concept in nurse aide practice. The other options are incorrect medical abbreviations. Question 13. The apical pulse is located at the: option A, wrist. Option B, neck. Option C, apex of the heart, 5th intercostal space, midclavicular line. Option D, elbow. The correct answer is option C, apex of the heart, 5th intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the 5th intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 14. Normal oral temperature range is: option A, 96.0 to 97.5 degrees Fahrenheit. Option B, 97.6 to 99.6 degrees Fahrenheit. Option C, 98.6 to 100.6 degrees Fahrenheit. Option D, 99.6 to 101.6 degrees Fahrenheit. The correct answer is option B, 97.6 to 99.6 degrees Fahrenheit. Normal oral temperature ranges from 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit, average 98.6 degrees Fahrenheit. 96.0 to 97.5 degrees Fahrenheit is below normal, hypothermia. 98.6 to 100.6 degrees Fahrenheit includes normal and low-grade fever. 99.6 to 101.6 degrees Fahrenheit indicates fever requiring reporting. Question 15. When a client with dementia is sundowning, becoming agitated at dusk, the nurse aide should: option A, keep the environment bright and noisy. Option B, use a calm, gentle approach and low lighting. Option C, give the client a sleeping pill. Option D. Ignore the agitation until it passes. The correct answer is option B. Use a calm, gentle approach and low lighting. Sundowning is managed with a calm environment, low lighting, quiet, and a gentle approach reduce agitation. Bright, noisy environments are overstimulating. Sleeping pills require an order and should not be the first response. Question 16. When providing care for a client from a different culture, the nurse aide should: Option A. Follow standard procedures regardless of culture. Option B. Ask the client about their preferences and respect them. Option C. Assume cultural preferences based on the client's appearance. Option D. Ask the nurse to provide care instead. The correct answer is option B. Ask the client about their preferences and respect them. Asking the client about their cultural preferences shows respect and enables culturally competent care. Following standard procedures without regard for culture may be insensitive. Making assumptions based on appearance can lead to stereotypes. Question 17. When performing chest compressions on an adult, the nurse aide should compress the chest to a depth of: Option A. 1 inch. Option B. At least 2 inches but no more than 2.4 inches. Option C. 3 inches. Option D. 4 inches. The correct answer is option B. At least 2 inches but no more than 2.4 inches. Adult chest compressions should be at least 2 inches deep but no more than 2.4 inches. 1 inch is too shallow. 3 to 4 inches may cause injury. Question 18. When assisting a client from lying to sitting position, the nurse aide should: Option A. Have the client sit up quickly. Option B. Sit the client up slowly and allow time for blood pressure to adjust. Option C. Pull the client's arms to sit them up. Option D. Have the client hold their breath. The correct answer is option B. Sit the client up slowly and allow time for blood pressure to adjust. Sitting up slowly prevents orthostatic hypotension, dizziness, fainting. Sitting up quickly can cause a dangerous drop in blood pressure. Pulling on arms can injure shoulders. Question 19. The nurse aide is performing perineal care on a female client. The aide should: Option A. Wipe from front to back. Option B. Wipe from back to front. Option C. Wipe in circular motions. Option D. Wipe in any direction. The correct answer is option A. Wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 20. A client at risk for pressure ulcers should be repositioned how often? Option A. Every hour. Option B. Every 2 hours. Option C. Every 4 hours. Option D. Once a shift. The correct answer is option B. Every 2 hours. Clients at risk for pressure ulcers should be repositioned at least every 2 hours to relieve pressure on bony prominences. Repositioning every 4 hours or once a shift is insufficient. Question 21. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A. Feed the client quickly. Option B. Provide verbal cues to chew and swallow. Option C. Puree all food. Option D. Remove the food after 15 minutes. The correct answer is option B. Provide verbal cues to chew and swallow. Verbal cues, example: chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 22. When counting respirations, the nurse aide should: Option A. Tell the client they are counting breaths. Option B. Count while appearing to take the pulse. Option C. Count for 10 seconds and multiply by 6. Option D. Count for 30 seconds and multiply by 2. The correct answer is option B. Count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 23. A client with dementia has incontinence. The nurse aide should: Option A, place the client in adult briefs without offering toileting. Option B, offer toileting at regular intervals. Option C, restrict fluids to reduce incontinence. Option D, ignore the issue. The correct answer is option B, offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting. Question 24. A dying client requests to see their pastor. The nurse aide should: Option A, tell the client the pastor is busy. Option B, contact the facility chaplain. Option C, change the subject. Option D, tell the client to pray alone. The correct answer is option B, contact the facility chaplain. Spiritual support is important at the end of life. The nurse aide should contact the chaplain or the client's clergy. Dismissing the request is inappropriate. Changing the subject avoids the client's needs. Question 25. After giving a client a back rub, the nurse aide should always note: Option A, the last time the client had a back rub. Option B, any change in the client's skin. Option C, the client's weight. Option D, the amount of lotion used. The correct answer is option B, any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document.